Hello, my name is Dr. Carol Coughlan. I'm the Medical Director of ART Fertility Clinic here in Dubai. Today I'd like to say a few words about fertility preservation. It's an area in reproductive medicine in which we have seen a dramatic increase in demand in recent years for many different reasons. Essentially, the purpose of fertility preservation is to cryopreserve or freeze gametes. So for men, this would be sperm, for females, eggs, and for couples, the ability to freeze or cryopreserve embryos. So egg freezing was initially conceived as a strategy to safeguard the reproductive potential of women who were at risk of losing their future fertility for particular reasons, and this was predominantly for cancer. There's no doubt that we have seen significant improvement in survival rates following cancer diagnosis due to earlier detection and significant improvements in chemotherapeutics and therapies. However, cancer therapy, including chemotherapy and radiotherapy, can be very damaging to a woman's ovarian function and to a man's testicular function. The American Society of Clinical Oncology have really emphasized the importance of discussing with reproductive aged women and also men the adverse effect that cancer therapy can have on their future fertility. They've also emphasized the need to discuss fertility preservation options with these patients and also stress the importance of referring them to see a reproductive medicine specialist prior to embarking on their cancer treatment. Having worked as the medical director at the National Onco-Fertility Centre in Ireland, I have seen firsthand the benefit of a consultation with a reproductive medicine specialist prior to patients embarking on treatment for cancer. As important as fertility preservation is to these patients going forward, needless to say, their cancer treatment must take top priority. We work very closely with medical oncologists to ensure that the fertility preservation treatments will not hinder or adversely affect their cancer treatment outcomes in any way. With that said, all reproductive aged patients should be given the opportunity to meet with a reproductive medicine specialist to discuss their fertility preservation options prior to embarking on cancer treatment. And if these options are not appropriate for them at that particular point in time, we can discuss options that may be available to them going forward in the future. The usefulness of fertility preservation is not only confined to patients with a cancer diagnosis, but to patients with other medical conditions, including endometriosis. Endometriosis is a condition which is well recognized to compromise ovarian function. Finally, another relevant branch of fertility preservation is known as elective fertility preservation, where women may decide to postpone parenthood or try to protect against the natural decline in ovarian function with advancing female age. This represents a great step forward in assisted reproduction and has been one of the most relevant contributions to this field of medicine in recent years. The younger the woman and the greater the number of eggs available to freeze impacts very strongly on the live birth rates. So the younger the woman embarking on the treatment, the better. It is mandatory that we explain to women who opt for fertility preservation for all different reasons that this is not an insurance policy to guarantee motherhood in the future, but it is a means to increase their chance of having a biological child. Essentially, what we are preserving is the chance.